Hi, my name is Dr. Daniel Colver from Uinta Basin Healthcare, here to give you a health tip of the week. This week is Suicide Prevention Week, and we could all do a little something to help ourselves, our family members, and our friends. First thing we can do is we can ask someone that we are worried about if they have any thoughts of suicide, of harming themselves, or feeling that they're better off dead. I know that seems like a heavy thing to ask someone, but research has shown that it actually does help, and it can open the door to further dialogue. The next thing we can do is, if someone is struggling, let's keep them safe. Let's help them, reach out to them, lock up any means of lethality that are in the home. Firearms. One of the most important things we can do as responsible gun owners is to lock up the firearms when we or our family members aren't safe around them. This doesn't mean that we have to get rid of them completely, but we have to keep them out of reach for the period of time that the crisis is undergoing. Another thing, lock up any medications that could be used for overdose or any other lethal means. Do a scan of the house and just temporarily secure the things that might cause some problems. Next thing we can do is be there with them. Be there, sit there with them, and just listen to what they have to say and what they need. A lot of times people feel scared to even ask for help. Best thing you can do is to let them know that they're not alone and that you're there with them. Another thing you can do is connect them to support. Reach out to a primary care provider, reach out to a mental health provider, reach out to a psychologist or a psychiatrist. Get them in to professional help as soon as possible, and maybe even show up with them for their appointment if they're feeling nervous or anxious about going in for the first time, which is also very common. Next thing is always follow up. So if they're safe and they're taken care of and they're getting in to see someone, follow up with them. Let them know that you're thinking about them. See how it went. See if they went to their appointment. See if there's anything else you can do to try to support them through this hard time. If you yourself are struggling, please get some help. Call the Suicide Prevention Lifeline, the national number. Reach out to your local primary care provider. Reach out to a clergy member, a friend, or a family. Reach out to our office. Reach out to the hospital. Go to the emergency room if there's a life-threatening emergency pending. There's local resources as well. There's Northeastern Counseling Center. There's local therapists you can find. Please reach out and get some help for you and your family.